Join us today on the 50 Shades of Pain show, where we're talking about how you and your kids can be safe going back into this athletic sports season. Welcome to the 50 Shades of Pain show, where we empower our community by demystifying pain, both physical and emotional, to give you the tools that you need for optimal. I'm Dr. Danish, the medical director of Wellward here in Lexington, Kentucky, and I'm here with my co-host, Dr. James Escaloni.
Hey.
We're talking about going back to school. So school just started, and lo and behold, James has a daughter who's old enough to go to college.
Crazy.
And she is a crazy strong athlete. And
collegiate wrestler.
Right, and we were talking about the differences between men and women in particular as we go into the athletic season, and what kind of injuries you're prone to depending on what your gender is. Now, there's no gender typing in this situation. There are just physiologic differences between men and women, particularly in that pubescent stage of life where hormones are radically changing. We see a lot of different types of injuries depending on what gender you are. A lot of it comes down to hormonal differences, as well as just the way the body makeup is, the construct of the body. So James, what kind of differences do you notice between men and women athletes?
So a big difference, especially because I'm a coach, I get to see this, is when they start to hit puberty. If you look at kids, especially if they're co-ed sports, when they're competing against each other, soccer, wrestling, they are almost at the same level for what they can do. But once puberty hits, there's a distinct difference. Everybody gets that growth spurt, but males have a protective sense of the testosterone and the muscle growth that's accompanying the same growth in height, whereas females don't get that same protective growth from the muscle. And so what happens right around that point, there's a sharp increase in a lot of injuries, especially to ligaments like the ACL. That's one of those big season-ending ones. So there's a lot of things that we need to consider to keep people in that area healthy.
And that's a great segue for the body configurations and constructs that make us more prone to injuries, one type of injury versus another. Like, one of the reasons that women have a higher propensity towards ACL injuries is because hips are a little bit wider set, which puts a little more of an inward force on the knees. And the ACL's role is not just to protect you from shifting the knee backwards and forwards, but it's actually creating a figure 8 that encompasses both your medial and your lateral meniscus, meaning that the ACL is responsible for distributing stresses that come from the menisci. With women having that wider hip set, that puts a lot more stress on the ACL, the medial meniscus, the medial collateral ligaments in your knees, and hence a higher likelihood of having those kinds of injuries. The other big change, hormonal, is that women go through these big cycles, hormonal cycles, and every time there's a menstruation cycle, there's a major influx of estrogen. And estrogen is a hormone that's intended to be there to make your ligaments looser, because as far as I know, women are the only gender that carries babies. Men are apparently not strong enough to do so. We do not have the hormonal makeup to carry babies.
Or the mental fortitude.
So when women are giving birth, the high load of estrogen is what actually allows for the pelvis to expand and contract and allow for the passage of a child. That same hormonal flux takes place as a woman athlete is going into their athleticism, and those hormonal shifts, because of those wild swings, you go from having ligaments and joints that are very well kept together to ones that have a little bit more latitude and flexibility, which if the body's not prepared for or not used to seeing that kind of a latitude, then it makes it very vulnerable to having injuries.
Now, two other elements that are associated with this are, like I was saying, when you are a female and you're going through adolescence, you have that growth spurt, but there's often not the same accompaniment of muscle protection, especially through the trunk. So what can happen is, instead of having this strong, tight posture in the core during athletic events, you don't have as much of the abdominal strength to be able to hold you in a lot of positions unless that's very well trained. What'll happen is that'll shift your pelvis into abnormal positions, because if you've grown a few inches, you're still learning how to use your body. And if you have not enough control of those positions, that pelvic change of position influences how your knees roll in and out. That can influence how well somebody can potentially have something like an ACL tear. And then the last part, when is this happening? That growth spurt, it's during adolescence and teenage years. That's when people start to stress out more about school. They start to have later and later nights. And what do our kids do best? Stay up way later than they should on their phones. bones. So throw in lack of sleep, increased stress, and inability to move their bodies. That's the best possible recipe for an ACL injury.
I'm laughing because we were out here and had perfect clouded weather, so sun wasn't in our eyes, and now exactly the sun is like right into your eyes. So I like your squinty look, James.
I'm trying to get my vitamin D on.
What can we do to protect our kids as they go into this athletic season?
Well,
I think you said it right there, is make sure that they're getting good sleep, make sure they're well hydrated. Hydration is huge when it comes to sports injury prevention because it keeps things flexible and pliable as opposed to brittle and likely to break. Good nutrition so that your body has the capacity to rebuild. Strength training so that your body has the redundancy where muscles can supplement ligaments and tendons in maintaining joint integrity, as well as protect it for situations in which you know you're going to get this big stressor coming in, and having that thick muscle to guard against excessive motions will help prevent some of those injuries from happening.
And what exactly he said is so perfect, but people just don't understand how much it needs to happen. When you're doing strength training, for it to have a protective effect for any sort of athlete, you need to do this for a minimum of 8 months, according to the research. So looking at this, if you've got a daughter who's trying to get into sports, or maybe you're thinking like, okay, we're going to take this up to the select team, something like that, and you don't want to have that ACL talk, well, start preparing them by getting some weight training into their world, make it a regular habit. And then the gift of weight training at a young age, they're going to start to do that later on in life. And then they might not have to come to Wellward because they've been so healthy, which is really what we want for everybody.
If you found this to be helpful, find us on our other channels. We've got Facebook, Instagram, YouTube, and of course our website, wellwardmed.com. And if we can be of service to you, please call our patient navigator at 859-275-HURT, H-U-R-T, or 275-4878.
And don't forget to sign up for our emails on our website. You'll get all this and lots of really cool information.
For all of us here at Wellward, I'm Dr. Donish.
And I'm Dr. Escaloni.
And we wish you joy and growth in your Wellward way.